Cancer immunotherapy is a recent addition to the weapons against cancer, and it has been a long time in the making because cancer immunology has provided a lot of insights into how the microenvironment in solid tumors works and how it looks like, but there were no real avenues in utilizing this knowledge to better help patients. Now, with this wealth of knowledge that we now have, the question is, how can we use this insight into making and improving the lives of patients in the end? So, with all this complexity being the real-life situation for immunotherapy, and the questions which type of cancer needs what type of immunotherapy, these open questions are still demanding and requires a lot of energy and multidisciplinary work. So, in an attempt to leverage the possibilities and try to bridge this gap between preclinical work and translational work and clinical science, the British Journal of Cancer is putting up a special issue on cancer immunotherapy. So, the variability of cancer setups of the microenvironment between breast cancer, colorectal cancer, and other cancer entities is a huge challenge, and we have to understand the molecular basis of the findings that we see in tissue sections, in histology, and understand the genetic changes that go alongside, together with the findings of what type of intervention is necessary for which patient. So, bridging these different areas from a cell-centric view, molecular biology, to translational medicine, to clinical science, understanding what are the side effects, what are the limitations of the therapies that we're applying, and where can we improve. This is clearly the attempt or the aim of the special edition here. So, if you take the area of checkpoint inhibition and the findings that in malignant melanoma and in lung cancer we have tremendous increases in response rates over time now with new therapies, there are still areas that are lacking this efficiency, and they're lagging behind in clinical development. And the aim is also with this immunotherapy edition to focus on these avenues, these new areas that are still being developed. Speaking of also including cancer, immunotherapy with cells, modified cells, genetic engineering as a tool to provide new possibilities, which has shown for hematology tremendous successes, but is still difficult to apply for solid tumors. So in this whole armamentarium of possibilities, the cellular therapies are clearly coming now to light, not only in hematology, and we're trying to pave the way with this special edition also in opening up these questions and possibilities that arise with the use of these cellular therapies. And in the broader context of oncology, the incremental change that immunotherapy has provided in a very short time frame shows the possibilities, and we would like to and hopefully do leverage some of that power of immunotherapy in the future, and the British Journal of Cancer will help you clearly to move things forward.